The Make America Healthy Again agenda has a lot of things to recommend to it. And specifically, prevention has always been a major focus in medicine. We have exerted most of our efforts at treatment. And in fact, many payers in the past did not view prevention as a most important focus. But in any case, I do think prevention of cardiovascular disease and prevention of cardiovascular events is really important. But I think you're asking about even what we could do earlier, and there are public health measures, and some of that is what's contemplated in the Make America Healthy Again movement. But some of that will be pharmaceutical, and I think there is great promise for cost-effective improvements in our population's health with the use of GLP-1 receptor agonists. The important thing about that is, though, for it to be cost effective, the cost has to be more modest. And I do think that the prices for GLP-1 receptor agonists, they have come down. They will need to come down more before we can make it sort of a public health approach that a large segment of the population should take these medications. I think the data suggests that a large segment of the population should take these medications, but we need to make it affordable and a value proposition for payers like the federal government. Interesting. I mean, there are recent publications that suggest that around a price of $150 a month, these drugs would be cost savings. I mean, that they would actually reduce costs in our healthcare system. I think the unanswered question yet is which segment of the population is this really? Is it everybody with any degree of overweight or obesity down to teens, I mean children? Or are we talking about a sort of more modestly elevated risk, so perhaps younger people that have higher BMIs? Or is it really middle-aged and older people? We need more sophisticated knowledge in this regard. And I do think pharmacists are the sort of pointy end of the stick here with regards to getting this work done. They understand these clients in a very personal way. They see these people quite often, and they're often the people that are advocating with their providers. I mean, the physician providers, the prescribing providers, and the pharmacy benefits managers to ensure that patients get the drugs they need. Our pharmacists in our clinics are really the experts at how to get these drugs covered in patients that